Hi, my name is Philip Schleip, and the topic I chose is access to mental health care. And why did I choose this topic? I chose to focus on access to mental health care because it is one of the biggest roadblocks to helping people get back on their feet and stay healthy. According to researchers at the Association of American Medical Colleges in 2022, access to mental health care has been a long standing issue in the United States, even among people with insurance. They note that in 2020, around 52.9 million American adults had a mental illness. Access has not improved significantly over time. From 2008 to 2019, the number of adults with mental illness jumped by nearly 30%. On top of that, less than 30% of Americans live in areas with enough mental health providers, like psychiatrists and therapists. According to the World Health Organization, also known as WHO, mental health enables people to cope with stress, learn, and contribute to their communities, yet access to care is still limited in many rural and low income areas. When people cannot get the support they need, symptoms often escalate into full blown crises, deepening mistrust in the healthcare system. I want to explore why this is an issue exists and figure out how I can help make a difference as a nurse by advocating for better care and equity. What are the impacts on healthcare? When access is delayed or unavailable, people in crisis often end up in emergency rooms or other general healthcare settings not designed for psychiatric care. This overloads an already stretched system and leads to burnout among the staff at those facilities. According to an article in Lippincott in 2025, transgender individuals in particular experience high levels of discrimination and difficulty finding providers, leading to increased mental health needs. When a population that is already dealing with discrimination and judgment daily experiences it when in need of medical care, you can see how that can make matters worse for that population. Ellis and Alexander in 2016 also explained that barriers like insurance denials and provider shortages disproportionately impact marginalized populations. These factors contribute to an uneven care and worsen health disparities. According to WHO, mental health disorders account for 1 in 6 years lived with disability, and nearly 1 billion people globally are living with a mental disorder. When mental health needs are unmet, patients experience higher hospitalization rates, longer recovery times, and increased risk of suicide. Mental Health America also reports that over 60% of youth with major depression in the U.S. do not receive any treatment. The CDC in 2024 data supports this trend, showing ongoing gaps in service availability. Untreated mental health issues also weaken healthcare trust, causing people to delay seeking help or avoid it entirely. What are the impacts on safety? When individuals are unable to access mental health care, the consequences for safety are profound and far reaching. According to the World Health Organization, or WHO, untreated mental illness can lead to dangerous behaviors and a greater risk of self-harm. Families often find themselves overwhelmed without the training or resources needed to provide support, which creates emotional strain, anxiety, and burnout. Lippincott in 2025 points out that healthcare professionals, particularly nurses, often experience high levels of moral distress and exhaustion when mental health crises occur without the proper team support or protocols in place. In addition, our ATI textbook stresses that environments lacking mental health crisis response increase safety risks for both clients and healthcare staff. From a broader perspective, Society is impacted through rising homelessness, increased incarceration rates, and growing pressure on emergency departments. Clear indicators of how unaddressed mental health needs ripple outward and compromise the safety of communities. And what are the financial costs? The financial toll of untreated mental illness is enormous and far reaching. According to the World Health Organization, the most significant burden stems from not just from direct healthcare costs, but from the substantial productivity losses when individuals cannot work or maintain daily responsibilities. Many who lack access to proper care eventually rely on emergency services or are placed on long-term disability, which drives up costs. The Centers for Disease Control and Prevention emphasizes that public systems such as Medicaid, Social Security disability insurance, and emergency departments often absorb these expenses, leading to higher taxes and insurance premiums for society as a whole. The failure to invest in early intervention means preventable crises become costly emergencies. Investing in proactive mental health services would save money by reducing hospital admissions, incarceration rates, and missed workdays, ultimately relieving strain on already overburdened public systems. What are the regulatory factors such as laws, policies, and reimbursements? The Mental Health Parity and Addiction Equity Act was created to ensure that mental health benefits match physical health coverage. However, according to the Commonwealth Fund, enforcement of these laws is inconsistent, and many insurance companies continue to violate parity requirements. Medicaid expansion and telehealth have helped, but gaps remain. Our ATI textbook also notes that nurses must be well versed in ethical practices, such as managing consent and confidentiality, especially in mental health settings. What is the impact of these factors? Although laws like Mental Health Parity and Addiction Equity Act were intended to ensure equal coverage for mental health and physical health services, many barriers remain. The Commonwealth Fund also explains that low reimbursement rates discourage healthcare providers from offering mental health services. Additionally, entire communities lack access due to shortages of trained professionals. These gaps persist because regulations, though in place, are not consistently enforced. Improving the situation will require better enforcement, increased financial support for mental health providers, more robust training programs to expand the workforce, and sustain investment in community-based care systems. So, what is the role of the professional nurse? Nurses are in a unique position to advocate for better access to mental health care because we are often the first to notice when someone is struggling. Our ATI textbook states that we are responsible for assessing mental health needs, ensuring patients are safe, and protecting their rights throughout the care process. We also help patients navigate a complicated system by connecting them with resources they might not otherwise find. In many cases, we are the ones recognizing early signs of a crisis and stepping in before things escalate. Our work does not stop at the bedside. We also collaborate with mental health teams, social workers, and community programs to strengthen the entire support network. Moreover, because we are expected to follow strict ethical and legal guidelines, we help ensure that every patient receives respectful and safe care. All of this makes our voice especially powerful when pushing for policy changes and funding that can close care gaps and improve outcomes. Thank you, and have a great day.